Hello my surgical friends. Today I would like to talk about sinus grafting procedure. A little disclosure, I'm not trying to convince anyone, I'm not trying to be an authority. I'm just expressing my own opinion based on the critical reading of the literature, my own clinical experience and common sense. And I'm more than open to your comments and opinions. So it's a very broad topic, and obviously we can't cover everything, but I'll narrow it down to a few points that I'd like to express. And basically it's the summary of the chapter in the third edition of the Sinus Graft book that I had the privilege to be a co-author of among other doctors. And when we talk about sinus grafting, we have basically two approaches. It's either lateral wall approach and it's Crestal approach. Nowadays I would choose Crestal approach whenever it's indicated, and whenever it's possible I'll try to place a dental implant the same very day. And my only criteria would be like if I can engage the dental implant at that very minimum height of the bone on the same very day. It can be 2 millimeters, can be 3 millimeters. There is no rule, but obviously it's not 5 or 6 millimeters like I used to believe in the beginning of my career. Different implants have different properties, so some implants can be stabilized, some cannot. So I don't have any personal affiliation with any implant brand, so I have a broad spectrum of models and manufacturers to choose from. There is a belief that the lateral wall approach gives more control of the Schneiderian membrane separation and elevation, and therefore it's a safer and a better approach. I can argue that because the most common complication, membrane tear, can happen during three things. It's either creating of the window, and there are different techniques and devices to overcome that, like piezo would be one of them. Secondly, it can happen during the initial separation of the membrane, and then it can happen when the membrane is already separated and we're trying to elevate this. So different literature gives different complication rate, but up to 30–40%. And I can say that it's more or less consistent with my experience, maybe slightly less, but this technique is not tear-free. Again, there are other means to solve this problem. You can use membranes and you can use PRF, etc., etc. But I would rather not have this to begin with. So if we look at the Crestal approach, the argument is like, yeah, but you're doing it blindly, and what if this perforation happens, then you're not aware of this complication, and how can you fix it? If we're talking about Crestal approach, I'm completely skipping the osteotome technique, because yes, you can fracture the floor of the sinus. I totally get it, but you cannot elevate the membrane with osteotomes, which goes back to completely different discussion. How much vertical height of native bone do you need to perform Crestal approach? And the answer used to be 5 to 6 millimeters, because that's how much we need to engage an implant. But in my opinion, this is not the case. You can engage your implant nowadays with 3 millimeters, sometimes 2 millimeters. It's totally depends on the design of the implant, nothing else, not on your sinus or the material you're going to use. So the reason they wanted you to have 5 or 6 millimeters of native bone for osteotome technique, because even if you get a membrane tear, your implant will still take and survive. Why? Because of those 5 to 6 millimeters of native bone. Do you get the difference? So even if your implant is completely, the tip of the apical half or third completely is not in the grafted bone, it will still be clinically stable in most cases. So when I go back to Crestal approach membrane elevation, among many techniques that I personally reviewed and studied, and we can talk about different rotary instruments, Versa bores, and other kits available on the market. We can talk about various balloons. So after reviewing all those devices, I came to the conclusion that your best device for elevating the membrane, not to get to the membrane, not to break that floor of the sinus, but to elevate the membrane, is the water itself. It's the hydraulic pressure with no balloons, with no capsule, with no... And the reason why, because water itself is the thinnest instrument possible. Because most of the perforations during the Crestal approach sinus grafts happen when there is that tension created at the membrane, when it's like a very narrow elevation. So there is excessive tension on the entire membrane. That's how you get perforation. So if you're using water, just think about it. It's very, very thin and it spreads out evenly. That's how you can elevate membrane circumferentially. And it's very simple, but yet it makes a lot of sense. Another point that I'd like to bring up is, like, surprisingly, the less vertical height you have for the Crestal approach, actually the better, because the closer the membrane will be, so it's going to be more of a visual control. What bone grafting material do I use for sinus augmentation? If it's a lateral wall approach, I almost exclusively use BIOS xenograft, because it's very stable, it doesn't resorb, and it's very radiopaque. And as we know in the literature, they compare different variations and mixes, and xenograft showed to be very successful, and this is my personal preference. When it comes to Crestal approach, my personal preference is the allograft in the form of a putty. And the reason why, because it has that consistency that makes me believe that even if I have small perforations, that graft will stay contained and it will yield a nice result. And I tend to observe this in my cases. So to support my discussion, let me share a few cases with you. Actually, it's the same patient, and I treated both sides with slightly different approaches. But before we go into reviewing the case, this is the hydraulic membrane elevation, and I'm not promoting any products, but there are several available on the market. But this is the principle that I happen to like, because as you can see, after you created access to the Schneiderian membrane via Crestal approach, and that could be done by different means. It could be done with rotary, as I said, it could be done with piezo, or even with osteotome. But then just please try to understand the difference between getting access, breaking through the sinus floor, and initial elevation of the membrane, because this is where the difference is. Because if you're trying to elevate that membrane via pushing the particles of the bone graft, or by pushing those pieces of broken floor, then where most complications occur. Or even if you're trying to do it with a rotary instrument, or even with a piezo device. This is different. This is, you're trying to elevate this with the water, with hydraulic pressure. And in my experience, the complication rate is much lower. So with this being said, let's review the case. I treated this case a while ago, and it's the same patient, so let's review upper left side and upper right side. Upper left side, we extracted failing teeth 13 and 14, waited for about 6 to 8 weeks just for soft tissue closure. Then I did lateral wall sinus graft, and then we waited for another 6 months, I think. Then we placed 2 implants, and then we waited for another 3 months, and then the referring doctor placed 2 final crowns. So the upper right side we approached slightly differently. So we performed a Crestal approach, hydraulic sinus lift. We placed 2 implants. And if you look closer at the immediate post-operative X-ray, it looks like 2 implants are almost sticking out in the sinus cavity. But I know for sure that during the surgery I didn't have any perforations. I definitely felt the integrity of the membrane. I felt that my bone graft was going in there in a very predictable manner. And sure enough, after 3 months, you can appreciate the new radiographic borders of the floor of the sinus. And this is not a true histology, I totally get this, but neither is this side. And quite frankly, I doubt very much that this is true bone here, all this bios xenograft. So if we compare upper left side that took roughly 10 months of just my surgical treatment, and the upper right side, and my surgical treatment was barely 4 months. You know, that's a huge difference right there. In terms of recovery, there is no question about it that Crestal approach without flap, the recovery is much easier than that lateral wall sinus grafting procedure. Financially, in our practice, this procedure, it's about 50% of cost of lateral wall. So just shared my thoughts with you. I'm open to any questions and comments, and thank you for your kind attention. See you soon.